So, when a new disease starts to pop up, how do public health officials track it? I mean, we're talking about an invisible enemy. Well, today we're going to open up the Health Detectives Toolkit and look at the real quantitative methods they use to make that invisible enemy visible.
And you really have to think about that. Counting cases is nowhere near as simple as it sounds. Not everyone who gets sick goes to a doctor, and not every doctor reports every single case. So the official numbers you hear about, they're often just the tip of the iceberg. The real puzzle, the real challenge, is figuring out just how big that iceberg is. And that takes some serious detective work. So in this explainer, we're going to dive into the tools, the actual quantitative methods that these health detectives have at their disposal. These are what turn a bunch of scattered, fragmented clues into a clear picture of what's going on. They help answer the big questions. Where is this disease? Where is it headed? And most importantly, how do we stop it? So let's start with the clues right there on the ground.
All right, so the first set of tools is all about getting your boots on the ground. To even begin to understand what's happening, you have to start by looking at the evidence that's right in front of you, at the community and healthcare level. This is where you're going to find all those initial clues.
The most basic tool, and maybe the most important, is just direct observation. Seriously, it's like a detective showing up at a crime scene. Health officials will actually go to clinics and hospitals to see for themselves. Are people using the standard definitions for cases? Are there charts on the wall tracking disease trends? It's all about gathering that direct physical evidence of how the system is actually working or not working.
And what's so powerful about this is just how raw and unfiltered the information is. This isn't some report that's been passed up through 3 different managers. No, this is seeing reality with your own 2 eyes. It gives you an invaluable baseline for understanding the real strengths and weaknesses of the system before any official numbers even get reported. Okay, so the next tool in the kit involves digging into the paperwork. And there is a lot of paperwork. Health systems produce just a massive amount of data every single day. I'm talking patient registers, lab records, hospital discharge forms. For a disease detective, these documents are like a treasure trove of hidden information. So what are they digging for? Well, by combing through all this data, they can start to spot trends in different diseases over time. They can measure how well the system is working, like how complete is the reporting from this clinic versus that one. And this is a big one. They can often find cases that were diagnosed but somehow never got officially reported. That gives you a much better sense of the true numbers. Now, those ground-level clues are absolutely essential. But to really truly understand an outbreak, you've got to zoom out. You need methods that can give you a snapshot of the entire population, not just the folks who happen to make it to a clinic. And this is exactly where surveys and questionnaires come in. I mean, let's be realistic. It's just not practical to talk to every single person in a city, let alone a whole country. So instead, these detectives use a really powerful statistical tool, sampling. They carefully pick a smaller, representative group from the total population to survey. And it's kind of like this donut here. By studying just one small slice, that's our sample, we can make a really accurate guess about the entire donut, which is the total population. This is how officials can estimate things like how widespread a disease is or what vaccination rates look like across an entire community, and they can do it pretty efficiently.
All right, now for what might be the most ingenious tool in the entire toolkit. It's a method that was actually borrowed from ecology. They originally used it to estimate how many fish were in a lake, and it's been brilliantly adapted for public health.
This brings us right back to that core problem, doesn't it? How in the world do you account for all the people who are sick but just stay invisible to the official health system? They're the biggest missing piece of the puzzle. Well, the capture-recapture method is designed to do exactly that, to estimate the size of this hidden group. So here's how it works. First, you capture cases from one data source, let's say all the official hospital records. Then you do a second, totally independent recapture using a different source, maybe private lab registers. Now here's the key. You look at the overlap. How many names appeared on both lists? The size of that overlap, believe it or not, allows you to statistically estimate how many cases were missed by both systems completely. It's brilliant. And that's why this is such a game changer. This method doesn't just count what you can see, it uses math to estimate what's invisible. It gives you a much more complete picture of a disease's true impact on a community, which is just absolutely vital if you're going to plan a response that actually works. So, we've got all these clever tools for collecting numbers. Direct observation, record reviews, surveys, this cool capture-recapture thing. But why? Why is this so important? This isn't just some academic exercise in counting. The data from these methods has profound, real-world consequences.
Because it's really not about the numbers at all. It's about what the numbers let you do. This data is what drives action. Every number represents a real person, and every data point is a call to do something. You could say this kind of surveillance is really the engine that powers public health. Without good data, officials are just flying blind. With it, they can save lives.
And here's exactly how. This data is how you detect outbreaks early, before they spiral out of control. It tells you what kind of response is needed and where to focus it. It helps you figure out if your control measures are even working. It gives you the true burden of a disease so you can get the right resources, and it helps you pinpoint which groups in the population are most at risk and need help the most. So as you can see, these quantitative methods are really the bedrock of disease surveillance. They're the tried and true techniques that have helped us fight epidemics for decades. But, as technology just keeps evolving with things like AI and big data analytics, you can't help but wonder, what amazing new tools will be added to the Health Detectives Toolkit next?